Benign prostatic hyperplasia, BPH, is a health issue that becomes more common with age. It's also called an enlarged prostate. The prostate is a small gland that helps make semen. It's found just below the bladder. And it often gets bigger as you get older. An enlarged prostate can cause symptoms that may bother you, such as blocking the flow of urine out of the bladder. It also can cause bladder, urinary tract or kidney problems. Many treatments can help BPH. These include medicines, surgery and other procedures. Your healthcare provider can help you choose. The right option depends on things such as 1. Your symptoms. 2. The size of your prostate. 3. Other health problems you might have. Symptoms. Common symptoms of BPH include 1. Frequent or urgent need to pee, also called urination. 2. Peeing more often at night. 3. Trouble starting to pee. 4. Weak urine stream, or a stream that stops and starts. 5. Dribbling at the end of urination. 6. Not being able to fully empty the bladder. Less common symptoms include 1. Urinary tract infection. 2. Not being able to pee. 3. Blood in the urine. The symptoms of BPH tend to slowly get worse. But sometimes they stay the same or even improve over time. The size of the prostate doesn't always determine how serious the symptoms are. Some people with slightly enlarged prostates can have major symptoms. Others who have very enlarged prostates can have minor problems. And some people with enlarged prostates don't have any symptoms at all. Causes. Enlarged prostate. Enlarged image. The prostate gland is located beneath the bladder. The tube that moves urine from the bladder out of the penis is called the urethra. This tube passes through the center of the prostate. When the prostate gets bigger, it starts to block urine flow. The prostate is a gland that typically keeps growing throughout life. This growth often enlarges the prostate enough to cause symptoms or to block urine flow. It isn't clear what causes the prostate to get bigger. It might be due to changes in the balance of sex hormones as you grow older. Complications. Complications of an enlarged prostate can include 1. Not being able to pee. 1. This also is called urinary retention. 1. You might need to have a tube called a catheter placed into your bladder to drain the urine. 1. Some people with an enlarged prostate need surgery to get relief. 2. Urinary tract infections, UTIs. 2. Not being able to fully empty the bladder can raise the risk of infection in the urinary tract. 2. If you often get UTIs, you might need surgery to remove part of the prostate. 3. Bladder stones. 3. These are most often caused by being unable to fully empty the bladder. 3. Bladder stones can cause illness, bladder irritation, blood in the urine and blocked urine flow. 4. Bladder damage. 4. A bladder that doesn't empty fully can stretch and weaken over time. 4. As a result, the muscular wall of the bladder no longer squeezes properly to force urine out. 4. And this makes it harder to fully empty the bladder. 5. Kidney damage. 5. Pressure in the bladder from not being able to pee can damage the kidneys or let bladder infections reach the kidneys. Diagnosis. Your healthcare provider likely will start by asking questions about your symptoms. You'll also get a physical exam. This exam is likely to include 1. Digital rectal exam. 1. The provider inserts a finger into your rectum to check if your prostate is enlarged. 2. Urine test. 2. A lab checks a sample of your urine to find out if you have an illness or other problems that can cause the same symptoms as those of BPH. 3. Blood test. 3. The results can show if you have kidney problems. Treatment. Many treatments are available for enlarged prostate. These include medicines, surgery and procedures that involve smaller, fewer or no cuts. The best treatment choice for you depends on 1. The size of your prostate. 2. Your age. 3. Your overall health. 4. How serious your symptoms are. If your symptoms don't get in the way of your life, you might decide to put off treatment. Instead, you could wait to see if your symptoms change or get worse. For some people, symptoms of BPH can ease without treatment. Medicines for an enlarged prostate. Taking medicine is the most common treatment for mild to moderate symptoms of an enlarged prostate. Options include 1. Alpha blockers. 1. Alpha blockers work by relaxing the smooth muscle of the bladder, neck and prostate. 1. This makes peeing easier. 1. Alpha blockers include alfuzosin, uroxetrol, doxazosin, Cardura, tamsulosin, Flomax, silodosin, Rapaflo, and terazosin. 1. They often work quickly in people with somewhat smaller prostates. 1. Side effects might include dizziness. 1. They also may include a harmless issue in which semen goes back into the bladder instead of out the tip of the penis. 1. This is called retrograde ejaculation. 2. 5-alpha reductase inhibitors. 2. These medicines shrink the prostate. 2. They do this by preventing hormone changes that cause the prostate to grow. 2. Examples include finasteride, Proscar, and dutasteride, Avodart. 2. They might take up to 6 months to work well and can cause sexual side effects. 3. Combination therapy. 3. Your healthcare provider might suggest that you take an alpha blocker and a 5-alpha reductase inhibitor at the same time if either medicine alone doesn't help enough. 4. Tadalafil, Cialis. 4. This medicine is often used to treat erectile dysfunction. 4. Studies suggest it also can treat an enlarged prostate. Surgery and other treatments for an enlarged prostate. Surgery or other procedures might help with BPH symptoms if you 1. Don't get enough relief from medicines. 2. Prefer not to try medicine. 3. Aren't able to pee. 4. Have kidney problems. 5. Keep getting bladder stones, blood in the urine or UTIs. Surgery or other procedures might not be an option if you have 1. An untreated urinary tract infection. 2. Urethral stricture disease. 3. A history of prostate radiation therapy or urinary tract surgery. 4. A neurological disorder, such as Parkinson's disease or multiple sclerosis. If you are new at our channel, please subscribe our channel. It will be great support for us.